Welcome to the AIW Empower interview series. I'm so happy to have our guest here with us, Mandi Counters. Thanks so much for joining me today, Mandi.
Absolutely. Glad to be here.
And how are you doing today?
Very good. It's a weekend. It's been a long week, but doing really good. Excited to be here today.
Awesome. So let's talk about your journey. Can you describe your current job?
Yeah, so I actually just had a transition into a new job as a nurse practitioner in the with the neurosurgery group. So I'm currently working in a hospital with neurosurgery. I've been doing neurology all of my practice, so it was a little bit of a leap, but using my current knowledge, moving into the next step, essentially.
Well, it sounds really interesting. Can you just quickly give us a description? What's the difference between your previous job and your current job?
Sure. So neurosurgery, I work with the brain and spine surgeons now. So working with them, I am a hospital-based nurse practitioner. So I round on all the patients that are potentially new consults in the hospital if they've had an acute illness with their spine or brain, or trauma perhaps with their spine or brain, and they come in and they need care. And I'm the first line of defense, essentially. So I get to see the patient first and do the assessment, see if it's something that needs to be passed along to the surgeon to evaluate for possible surgery, or if it's something that we can monitor and do further imaging for. And then I see all the patients after surgery. So in follow up for their post-operative outcomes, doing education with them for reminding them of the education that they received before surgery, if it was a planned surgery, about what kind of restrictions they might have or what the healing process is going to look like. If they have staged surgeries, what future surgeries might look like, and then getting them prepped up for discharge. So that's a little bit different than the prior role that I did in neurology, where it was always a consultant role. So we only saw patients on a consultation basis. If they were in the hospital for some other medical issue and they had a neurological question come up, or if they came in the emergency room with symptoms of a stroke or other neurological diagnoses like migraine or a little bit more rare cases like Guillain-Barré or myasthenia gravis, things that you don't see very often, those would be under the neurological category. So we would get consulted on those patients, do all the workup on them, diagnostic testing, lab work, identify any medications that were needed for the patients, and then follow them until we were done with our work, and then pass them back to the rest of the team to finish up any other care. We didn't have to do the whole discharge process. So it's a little bit different, a little bit more responsibility now, but still using that knowledge of what those neurological symptoms are, or there's a lot of overlap between something that could be a spinal issue. Is it surgical? Is it neurological? And I got to see that the other day where I would have seen that same kind of patient for a neurological workup. Now I saw them for a spine workup. And it was kind of cool being able to use that same knowledge that I already had.
I find that extremely interesting, and I'd really love to hear how you got here. Can you talk about your really unique career path that you took to get to where you are today?
Yeah, so I didn't follow the traditional route. Most people, to get to where they are, go through a bachelor's program in nursing. To be a nurse practitioner, you have to go through a bachelor's program in nursing, followed by grad school for nurse practitioner. And I did not take that typical route. I went to a 2-year RN program first. So I became an associate degree nurse, worked as an associate degree nurse while I got my bachelor's in nursing, and did that in another 2 years. And then I went straight into my master's degree, thinking that I was going to teach. So I got a master's degree in nursing, and I did ultimately use that for teaching, but then I really missed being at the bedside. So I went back to school again for a postmaster's certificate in nurse practitioner.
Wow. And
Roundabout way to get here.
can you, for the listeners, explain what would be, I guess, a more typical and how yours has led you to where you are now versus perhaps where you might have gone straight through maybe teaching or something else had you been in the more traditional route?
Mm-hmm. So more traditional, you get your bachelor's in nursing. So you kind of skip the associate degree, you go to a 4-year program, get your bachelor's in nursing, and people may or may not have experience working as a nurse then at that point. There's quite a variety. You could do either one, and then go into a nurse practitioner program, which for most people takes it's a 3-year program. They many years ago, they had talked about having the DNP, the doctor of nursing practice, be the kind of the standard baseline for being in a nurse practitioner. And that kind of went by the wayside. It's not a required degree at this point to be a nurse practitioner, but there you will find people that have it. There are still plenty of master's degree level nurse practitioners out there. It's not a ton of difference, honestly, between the two, but it's sometimes a more accessible route to go to a master's degree program, because some people are a little bit intimidated by the thought of becoming a doctorate in something. But so that would be your typical route. You get your 4-year bachelor's in nursing, and then you do the 3 years of nurse practitioner school on top of it, with or without the experience in between. With my way of doing it, I got to have nursing experience as I went along. So with my 2-year RN, I got to work with that degree. Things have changed a little bit since the 20 years since I've done that. So not everybody is able to have the same experience working as a nurse that I did with my 2-year RN. I was able to go right straight into the hospital and work with the patients directly in the hospital as an RN with a 2-year degree, while I was working on my master or my bachelor's completion program. And it was a great experience. I don't think I would do it anything different, because I loved every step of the way.
That's amazing. And I just to cover the basis, because I know I had this question when we first talked, is can you explain what the difference is between an RN and a nurse practitioner?
Yeah, so that question comes up a lot actually for me. Some of my patients don't even know what the difference is. An RN is a registered nurse, so it can be a 2-year level or it can be the 4-year level. They both take the same licensure exam. So the NCLEX exam is the RN licensure exam, national standard, regardless of what program you go through, whether it's a 2-year or a 4-year program. And as an RN, you get to carry out the orders that an advanced provider gives you, whether it be a physician or an associate advanced practice provider, being either a nurse practitioner or a physician's assistant. So the RN doesn't have the capacity to order things unless it's following a standard protocol. There are some standard protocols that we do all the time, like flushing an IV or things like that, or ordering a speech pathology consult. That would be okay for a nurse to order as long as they had that protocol in place. Otherwise, they assess patients, they come up with plans of care based on a nursing knowledge, what they're going to do for the patient. They follow the orders written by the advanced providers, but they also acknowledge what's going on with the patient, and they advocate for the patient. So they are the eyes and the ears for the providers every day, every minute of every day, especially working in the hospital. The nurses are at the bedside. They're providing all the care at the bedside with the assistance of the other people in the team, such as nursing assistants, the therapists that come in. And then as a provider, I'm typically in that room once, maybe twice a day, whereas the nurse is there all the time. As a nurse practitioner, I have advanced knowledge in the different health systems. I can then order diagnostic testing, order blood testing. I can order the medications for the nurse to administer to the patient. I can assist in surgery with the doctor. Don't do the surgery myself, but I can assist. So it's a different level of responsibility, meaning your liability goes up. So insurance is a little bit more expensive, but it's a different knowledge base. It's a different set of responsibility, and it's not for everyone. So I've worked with several RNs that didn't care to ever be the nurse practitioner because they didn't want that level of responsibility. Whereas I sought for it. I wanted it.
I love that. I can see where some people would really enjoy having that extra set of responsibilities, as well as getting that extra knowledge to get there. And
Yeah.
what kind of demand typically is there for a nurse practitioner for any given hospital? I guess for a regular hospital.
Yeah. So probably in the last decade or so, it's been a huge demand for nurse practitioners. The practice essentially came up because of a physician shortage. So years ago, they identified that not as many people were going into med school anymore, and a lot of the older physicians were retiring, and there weren't as many people coming up to fill those ranks. So the nurse practitioner position was created as kind of a bridge to help that. So a physician extender, some people call that, because we as both nurse practitioners and physician assistants help to extend that reach of the physician. So we can assist. We take a lot of care of those patients and refer back to the physicians when there's something a little bit more complex. We don't have necessarily the same level of education on all the different illnesses. The one thing I will say is that when you're in a specialty area, like I've done, either neurology or neurosurgery, when you have as much experience as we get, we can become just as knowledgeable as the physician because we've had the experience. And as a nurse practitioner with 11 years of experience in neurology, I had more experience with those patients than the physicians just coming out of school. So that experience level is something that you can't buy in a school.
Mm.
It's experience that you gain on the job. And it's so rewarding. I love it.
And how is it with the patients? And so you mentioned some don't really know what a nurse practitioner is.
Mm-hmm.
Do you find that once it's explained, they kind of understand, or that there's a disconnect in the way that it's communicated? Because to be honest, before meeting you,
Yep.
I think I had heard the words, but I don't really think I understood that there was a difference, and it was more of an in between a doctor and a nurse, but more so closer to being a doctor or a physician.
Yeah. Yep. I do find that when I explain it to my patients, they understand it a lot more. And I think a lot of it is in how you present the material. So when I talk to my patients, if they ask me, what is a nurse practitioner? I tell them, well, I practice essentially the same as a physician, but I didn't have the same amount of debt. So, and the bottom line is I don't get paid like a physician, but I don't have the debt of a physician. So I practice very much like a physician. The only thing that I can't do that they can is surgery. So beyond that, I physically can do anything that they do. And I've had some patients that have asked me, well, are you going to go on for more school to become a doctor? And I explain, no, that's not the typical progression. You don't generally go from nurse to nurse practitioner to doctor. This is the terminal degree that I'm going for. I'm not going for anything more. And I love what I do. So the other benefit that I will explain to patients is that you essentially get the same kind of care as a doctor, but you get more time with me. Because as a nurse practitioner, I have more time allotted with my patients than most physicians do.
Oh, and that's so important. I'm sure it's something they appreciate quite a bit.
Absolutely. Absolutely.
So let's dive into a few more things from early in your career.
Yeah.
What kind of skills did you develop early in your career that you find really serve you now?
I think one of the biggest things was time management. When I first started working as a nurse, I was on a med surg floor. And for those that aren't unaware of what that is, that's just short for medical surgical. So any kind of medical diagnosis or simple surgical diagnosis, they all kind of get plopped on the same floor in the hospital. So you could be taking care of a patient with pneumonia in one room, and they could have had some sort of abdominal surgery in the next room. So it's a little bit of everything. The floor that I was on had a mixture of 7 different things. So we had neurology, urology, ophthalmology, ENT, neurosurgery, adult cystic fibrosis, and I think there was something else too. I'm missing the whole list at the moment. But in order to do all of that, we also had a 2-bed step-down ICU. So we had two beds where patients were a little bit more critical than the rest of the patients on the floor, but they didn't quite meet the needs of intensive care. So the need to build your time management skills and your prioritization skills were incredible because you needed to be able to manage a list of patients on your own. And there's the rest of the team that you can ask for help, but those are your patients for your shift that you're on. So you are responsible for their care. And in doing that, you have to make sure that you plan for all the medications that they need, all of the, if they need a bath during your shift that you're on with them, if they have diagnostic testing they have to go for, if there's going to be therapies coming in and out of the room on the day shift, especially knowing how to fit all of that in your day. And heaven forbid something goes wrong with someone, you have to shift that. So if you have an emergency with one of those patients, you have to shift everything else from your other patients to either the assistance of another colleague or move things around a little bit with what you had planned with everybody else. So learning to be able to manage my time wisely so that if emergency came up, that I was prepared for it and it wasn't going to rock my whole day was huge. And learning how to prioritize the care. So we use the term triage a lot in healthcare, being able to triage and determine what's emergent, what can wait. And when you start your day, you have a list of patients. You have to figure out, who do I need to see first? That kind of sets your whole day, knowing which one of your patients are more critical, which one's going to take a little bit more extra time. So getting those skills underway set up the whole rest of my career.
I think that speaks probably to a lot of people that
Mhm.
getting that down is really important. I'm curious though, is this something that they touched upon when you were in school, or when you get into your first job, you're kind of just thrown in and you just have to figure it out right away?
Most school programs will kind of touch on it at least a little bit. They encourage us to keep some sort of tool to keep ourselves organized. Uh, the caveat with that is that when you're in school, you're generally not taking more than 2 patients at a time. So we start with 1 patient and then we move up to 2. Occasionally in some programs, you'll have 3 patients that you're working with another nurse to take care of. However, most programs kind of max out at 2. Whereas when you're on the floor, you're taking care of 4 or 5 patients. Critical care, you've got 1 or 2. But when you're on a regular floor, you've got 4 or 5. And if you go to a long-term care facility, you might have 15, but you've got more nursing assistants to help you. So the different settings will determine how many patients you have on your list, but generally for all of them, it's going to be more than what you had in school. So they try to set you up for that organizational skill, but you really get thrown into it when you first get out on the floor.
Okay, it's good for people to know, I think, to,
Yeah.
set your expectations as well,
Yeah.
and to know that there is a learning curve.
Yep.
And speaking of learning curves, along the same lines, but flipping the questioning a little bit,
Yeah.
what mistakes did you make early in your career?
Yeah. There's one mistake that still hits me hard because I don't like making mistakes in general. But pretty much everyone at some point will make a mistake in healthcare because we are human and it happens. But my mistake was a medication error. And uh, back in when I first started working as a nurse, everything was in paper. So all the charts were on paper. We had our hardcover chart that we came in the room, and then there was a paper medical administration record, as we call it, a MAR in the hospital. And I looked at my MAR at the beginning of the shift, and I knew what medications I had to give to my patient. And at the time to give a certain blood pressure medication, I went to the drawer in the room because that's where we kept our medications, was the drawer in the room next to our paper medication list. And I went to grab that medication, grabbed it, looked at the MAR, went to give it to the patient. And then when I looked back in the chart the next time, I realized that the order had changed on the medication. So this paper chart had been taken, they changed the order. Pharmacy had already sent the new medication, but it hadn't gotten transferred onto my MAR yet. So I grabbed what I thought was the correct medication, but it was actually the wrong dose. We were crushing the medication and giving it down a feeding tube. So the pharmacy had sent a new form of the medication that was more easily crushable. So it was a better route to give to the patient. But by doing so, it changed the dose. So it changed the concentration. Can you hear my dogs barking?
No, actually.
Okay, good. Sorry about that.
No, it's okay. You might hear mine too, so.
Okay. So when it changed that concentration, I actually had a much stronger medication that I was giving to my patient. And I gave it based on the dose that was listed on the paper MAR. And the doses were quite different. So the one medication that I actually gave the patient of the previous dose was much more highly concentrated. So it was a higher dose of the medication. There was a risk that I could have significantly dropped the blood pressure on this patient to a very dangerous level. Thankfully, the patient had blood pressure of like 200 something over 100 something, and it brought it down a little bit more toward normal. So there was no ill effect to the patient, but it was still an error. And I reported that error because we were always taught if you make an error, if you make a mistake, you need to report it. And it's not a punitive thing to make errors and to report them when you make errors. So I wasn't afraid of being punished, but some of my colleagues asked me, well, why'd you report that? It was your error and nothing happened. Like, but something could have happened. There was that risk. Something could have happened significantly wrong with that patient by giving too high of a dose of a blood pressure medication. And it was still an error. And it turned out that these 2 medications, that because they were very similar, the first part of their name was the same. and the packaging was the same. So pharmacy did an investigation on this error, and they found that these two packages were very similar, and they actually changed the packaging because I reported my error. So it was not a punitive thing. It was a learning opportunity for the hospital so that they could correct it and nobody else made that same mistake.
I
So
really
yeah.
I love your mistake,
Yeah.
as strange as that is to say, for a few reasons. One, that you reported it,
Yeah.
and you thought it through enough to say, your colleagues are telling you not to, but you're still doing it because it's the right thing to do.
Mhm.
Also, that it's not a punitive system, that they
Mhm.
actually want to fix these mistakes and investigate, and then change was made. So, as a medical person going to hospitals, it's something that I love to hear,
Mhm.
um because we don't know what goes on behind the scenes, and so I think it's people like you that make us feel really safe and taken care
Mhm.
of, so I applaud that.
Thanks. Thank you. Yeah, it's always, I always have a hard time when people that I work with say they don't want to report something, even if it isn't a mistake, but it's something that could be fixed, because that's the whole part of what we do. We do process improvement things all the time. We want to make it the best foolproof process as possible. The problem with that is that we have all these human beings in it. And as
Mhm.
humans, we make mistakes. It's not to say that just because we're in medicine that we're not going to make mistakes. And sometimes it's the person at the end, it's their fault. And sometimes it's an error along the way. And so sometimes I hate to use the word fault, because even the person at the end might have best intentions, but they missed something along the way. So it's a learning process. There's always something in the process that can be corrected to prevent it from happening again. And that's where we need to take that time to actually acknowledge the error when it happens.
Yeah, I think it's so important just to make sure at every step, if you can make it better, if you can make it safer,
Mhm.
it's always important. And I'm sure for those who don't, it's a mistake that they make, without really intentionally doing it, but it could
Mhm.
end up being a mistake. Um, so in doing so, you made a really good decision. Is there something that you look at and you think it was your worst job decision? Not necessarily something you did at the hospital, but a career decision you might have made.
Yeah, there was one at one point that I made a decision to change career, or change kind of lines in my career, not career completely, because I was still a nurse practitioner, but um, there were some political changes at the hospital that I was at, and my role was eliminated, and I had an opportunity to look at other options, and took a risky position, and was offered a position at a really small clinic that they touted themselves as being up and coming and growing and like the future of medicine, and they were going places and had some amazing things that they were going to do. And I was charmed into the position quite well. I thought it's close to my home. This sounds perfect. We can build things, and I can have some really amazing power and oversight within this clinic to help it grow. And when I got there, it was nothing as was promised, and ultimately ended up being a very unethical practice that made me nervous for my career. And my worst decision by taking that turned into my best decision by getting out of it as quickly as I could. Because once I realized how bad of a decision I had made, I made quick steps to change that and get back into alignment with what I actually believed was right for patients. Because there were things happening in that practice that I did not align with. It was just not a safe environment to be in, and I wanted out of it as quickly as I could. So that was probably my biggest career mistake, but it was a learning opportunity at the same time.
That I feel like probably with this one as well, a lot of people will relate of the quick in and out of, oh no, this is
Yeah.
not what I was sold at all. And to put perspective on it, because there might be listeners or people watching from different countries, you work out of the US,
Mhm.
and the medical system might be different depending on each a person's country.
Mhm.
In terms of people establishing clinics and private clinics and having different kinds of ownership,
Mhm.
is that something that is more or less that happens more or less where, you might go into a clinic and depending on, the ownership or the kind of financial backing they have, that it might be a better place to work or, as in your experience, a place where
Mhm.
you really don't want to be?
Absolutely. So regulations will change depending on where you are, but I
Okay.
think I've talked to people from various countries, and there is the possibility of opening your own clinic just about anywhere, from the various places that I've talked to people through. And in some places, it has to be a physician that opens it, and in some places, it can actually be a nurse practitioner that opens a clinic. In Minnesota, where I am licensed as an independent practitioner, and if I wanted to start my own clinic, I absolutely could. So there would be nothing stopping me from doing that, short of having the financial ability to do so. But it's quite possible that anybody could start a clinic. You just need the degree, the money, the finances, somebody to back you, and then the marketing ability to do so. So that's the unfortunate part of it, is that there's not a lot regulating who it is that's opening these clinics. I've worked for some private practices that were amazing groups to work for. And the group technically that I work for now, we work out of a couple different hospitals, but it's a private practice that contracts with these hospitals to do the work. And I've been with them for a week, so I will give that caveat, but they are so far absolutely amazing. And the longevity of the staff within their group is amazing. So it's a very good, reputable place to work. Whereas I didn't look into the longevity of people at that the clinic that I was at for a very brief time. So live and learn. That's where you learn from that part. Because anybody can start their own clinic, you do need to do the research to make sure that you're getting into a position that's going to fit you. We always encourage that. So when you start at any new job in any field, you should do some research on the organization that you're going to go work for, and some of that should be looking at the longevity of their employees, any kind of reviews there are on the organization itself, looking at their goals, their beliefs, their core values. Are they in alignment with what you're doing? Because that will more likely get you into a situation that will be a healthy one rather than something that you feel you need to get out of within a couple of months' time.
Agreed. I think it's always the adage of it's a two-way interview.
Yeah,
They are interviewing
absolutely.
you, and you're also making sure it's a good fit for you and in line, like you said, with your values.
Yeah.
So very curious though, since that was along the lines of your worst decision, in terms of changing your career path. Do you find you've had any weaknesses that have impacted your career path or just your job in general? And it could be in a good way or in a bad way.
I think sometimes, well, even with that particular job, I think I have a lot of weakness for other people, helping other people. That's why most of us go into healthcare, is because we want to help others. But I didn't leave the clinic at that point because I didn't want to leave the other people that I was working with behind. I felt like I needed to be there to advocate for them a little bit as well. So I didn't leave until several of them left, in addition to me, because I did not want to leave anybody behind on that. So I feel like that's caring for others can sometimes be a weakness, because even if it's not in the best interest of myself for a position that I've been in, I've stayed possibly longer than I could have for some, because I was worried about how it was going to affect other people. And up until this last change, honestly, I didn't do a lot of changing positions for my own benefit. This last position, it was to grow myself as a practitioner, because I had gotten to a point where I kind of was at the top of what I could do in that field. And in that role specifically, I was at the top of what I could do. And I like to grow. I like to continue learning things and advancing my career. And I didn't have that opportunity. But moving into this new role, I had that opportunity. So it's learning from your weaknesses is always a good thing. And learning the fact that I did things a lot for other people, I finally took a chance to do something for myself and grow my own experience on this, rather than just going along with other people's plans.
I love that. Do you find it took you a while into your career to develop that sense of a bit more, it's not even selfishness, it's just, self-empowerment where you start to put yourself ahead and think of yourself first?
It did take me a long time. I worked in the hospital in various floors for a long time, and when we initially moved for my ex-husband to go to medical school, and that was an opportunity that I had to move into a teaching role, which I had loved, thought that that's what I wanted to do. And once I got into it, I realized how much I missed the bedside. And that's when I went back. So I think I got a little empowered at that point because I realized how much I missed the bedside and wanted to go back to get my nurse practitioner degree. But I really didn't really purposely start acting on my own things until just a few years ago. So I've been in healthcare for 24 years. And it was just these last few years that I really started acting for my own needs. So yeah, it took me a long time.
It's all a learning curve, right? Like
Yeah,
even within our own emotions, our own motivations,
yeah,
everything can take some time.
yeah,
And I can
absolutely.
imagine in your field, it would be that much harder because you are surrounded by people you want to help.
Mhm. Hmm. Absolutely. And I guess that whether it's a weakness or not, I am a very strong empath. So I feel other people's feelings. So when I am feeling the stress of my colleagues, I take it on personally. And it's even more so exhausting than just taking care of patients myself. When I'm giving bad news to patients, I feel it. I feel their emotions. A couple times I've shed tears with them because it's hard to hold all of that in sometimes. And then I go home absolutely exhausted. So it's a weakness, but it's a strength all at the same time because then my patients see that I'm a human. They see that I have emotions too. And they see that I actually care about what's going on with them because they can see how it affects me.
And would you say that would be your biggest success factor in your career?
I think so, because I have had that ability to see my patients where they are and meet them where they are. So I've had, in my own life, I've had my own health struggles. And every once in a while, when it's pertinent, I will share some of my struggles with my patients just so that they can realize that they're not alone, that that even as a healthcare provider, I've struggled with coming up with answers on my own health issues. And knowing that there's always somebody else that you can find to support you when you're not feeling it. So um, just continuing to advocate for themselves and continue to push forward and look for answers, but knowing that they're not alone is kind of the biggest thing in that. I've had a lot of patients really thank me for my empathy, for being there, for sharing my feelings and emotions with them when necessary, and then just being thankful that I am there listening and being present with them, because that's part of that empathy is I do give them time to speak. I give them time to answer questions and really kind of think through things as we're trying to dig to the bottom of what's going on with them.
And I think this question is probably going through other people's mind now, as it is mine. Um, how do you compartmentalize the negative aspects of the job, like the severe illnesses and the deaths that you see?
Mm-hmm. Sometimes it's really hard, honestly, because I've had times where it's just negative upon negative, and that happened well into COVID when we didn't have a lot of resources to our disposal. We didn't have family members in the room, and as a provider, sometimes it's really important for me to have family members there. In neurology, especially if I've got a patient who can't answer questions, and I really need that information from their family, or they're going through a really tough diagnosis and they don't have that family there to hold their hands. I did a lot of hand holding. I did a lot of explaining, a lot of going through some really hard conversations over the phone, which is hard enough in person. And then you add the over the phone aspect of it. Um, Caregiver burnout is a real thing. Healthcare provider burnout is a real thing because of all of that. 2020 COVID hit a lot of people really hard. And I did struggle for a while trying to keep my own emotions in check because it was very stressful. I will say things that keep me balanced is when I get to have those good days, when I get patients that they have huge turnarounds in their recovery, or we're able to acutely treat a stroke patient who came in and we gave them a clot busting medication and it stopped the stroke and they're almost back to normal. That helps to offset those bad days. But at the end of it, it's all down to me and what I can do. So I come home and I love on my family. I give my kids and my dogs as much love as I can. I give my significant other the love, and then I work out because that's my release. I find that when I go for a run, especially on the rain, it's very therapeutic. When I go for a run, I can solve all the world's problems, and I can diagnose things in my head. And when I come back for that run, I feel relieved, and the stress is gone, and I can move on and go to the next day.
It really sets an image in my mind when you say
Mhm.
that. And just imagining it sounds very, yeah, very therapeutic.
Yeah.
Just water and being able to run at your own pace.
Yep.
The hospitals, does your job offer anything for mental health, for anything? Because especially as you mentioned, COVID, now we're hearing a lot about first responder mental health issues and how there's been a big effect, but beyond COVID, there's always been things going on that would
Mhm.
affect first responder mental health.
Mhm. Even before COVID, if we had a big event that happened or a very traumatic death of a patient, we would have debriefing episodes where we would get together with all of the staff that were involved or whoever was willing, uh, that wanted to participate and come to the debriefing, and we would talk about it as a group. Because of all the privacy laws, we don't want to share that with people outside of that group of people, but anybody that was involved in the care of that patient was welcome to come and participate in those debriefings. I don't know that every facility has that, but the places that I've worked have. And I was in on those at least once or twice that I can remember. And we would talk about what happened with the patient, kind of if there was anything else that we could have done to come up with a different outcome, or just how we felt. And every organization has an employee assistance program, the EAP program, which I think that's a pretty much a general rule. But in the hospital work, as at least we always have that. So they part of that is mental health. So you can call on somebody if you need that mental health support, and you have several free visits that you can have with a mental health provider to discuss the issues that you're having at work or on a personal level. So it doesn't have to be just specific to work. Sometimes the stress in our home life over kind of spills over into work, and then vice versa, the stress from work life can spill over into our home life. So that employee assistance program is really important for people to tap into. It might not always be the perfect fit on the health mental health provider that you need, but it's something to get you going and kind of help you through it. But I'm a big advocate for having a mental health provider, somebody that you can talk to. I have my own because I've had personal life issues that I've needed it for. And then during COVID, I talked to both to my primary care physician as well as my mental health provider about the stress that I was experiencing, because I needed that outlet as well.
It's so important. I think that, I'm really happy that it's much more in the forefront of people's mind. It's being normalized a lot more, but it's so important that we don't try and go it alone all the time. And that
Yeah.
we talk to people about what kind of outlets are they using, because you may not even think about running in the rain, but maybe it'll work for you too,
Mhm. Mhm. Yeah, and I'm not a fast runner by any means, but it's still therapeutic nonetheless.
Still running.
Yep, absolutely.
So, what sacrifices have you made throughout your career or at any given point to get to where you are now? And do you find that those sacrifices were worth it?
Mm. I think probably one of the first sacrifices I had to make was potentially time with my son as I was going to nursing school. I had a 2-year-old son already by the time I started nursing school. And on days that I had him, I would get him to bed, and then I would start working on my homework. And I was sometimes up until late in the hours at night. So I sacrificed a lot of sleep in order to do that. But and then there were times that if I had to be in class for long days, I did sacrifice time with him, because he then either had to be with his dad or with my other family members that could help out and help with that, because I was a single mom at that point too. So trying to raise a child at that point and go to school at the same time at times was very difficult, but I had to keep my end goal in mind. And the big thing that I kept reminding myself is I'm doing this for a better life for myself and my child. And it absolutely was worth it in the end. I missed out on a lot of sleep, and I can't exactly tell you how we potty trained my son, but it got done. And I got done with nursing school, and I think one of my favorite memories, even from being his mom in nursing school, was when I went to pick him up from daycare one day. One of his little buddies was playing in the little sandbox they had with cars in it, and I still remember this like it was yesterday. It was probably 24 years ago. And this little boy was playing in the sandbox, and he looks up at me and he says, "You're Sean's mommy?" And I said, "Yep." He said, "And you're in college?" I said, "Yep." He said, "Mommy in college? That's weird." But my son never grew up thinking it was weird because that's
Yeah.
just what he experienced. So he went off to college and there was never a question because he saw me do it when he was little, and that's just something that we did. So again, I got reimbursement for that sacrifice that I did with my time and my life at that point, because he turned out to be a pretty great human being as well. So
That's lovely.
yeah.
It's a really good example. And I'm sure that little boy who said it was weird,
Yeah.
it probably stuck with that little boy too.
Very, very well could have.
Yes.
So it was not an easy process by any means, but it was definitely worth it in the end.
Great. Going back to, let's say, the past 10, 20 years, if you had to pick one thing, what makes your work or your job more difficult than you would like it to be?
Hmm. I think probably still the misunderstanding of what nurse practitioners do.
Mm.
And a lot of it is from the people that I work with, not even just with patients like we talked about earlier, but just the understanding or misunderstanding from providers that I work with, physicians specifically. It still is, even though nurse practitioners have been around for 30, 40, 50 years now at this point, even though we've been around for a long time, there are still a lot of physicians who don't like us present. They think that we're trying to take their jobs, and they don't value the input because they think that physicians should be the only ones in this role. So I still get pushback from that, and it's still a very difficult thing to deal with when I have people that should be colleagues of mine and should be on the same team for the patient, and yet they are going around me to talk to the physicians I work with because they don't see me as a big part of the team, or they don't value my input on the team because they think, again, it should just be a physician. So I think that's been probably the hardest thing, where I feel like in 2023 we should be beyond that, and we're all on the same team to help the patients. I'm not here to take your job. You can keep your job. I don't want those hours. I love what I do, and I'm here to help assist you to take care of the patients so that we have all the coverage that we need, especially with all the gaps that there are in the physician coverage. We are so very necessary to be here as nurse practitioners, and there are still complex patients that I will not hesitate to go grab one of my colleague physicians and have them come help me because I haven't seen it. And I've been an NP for 11 years, and there are still things that I haven't seen. So I will grab one of them and come help me. So I'm not above asking for help. I would rather ask, and I tell people that I precept all the time, I would rather ask what seems like a silly question than make a stupid mistake. And I will always ask for help, and I will always ask for the input of the physicians that I work with. And most of the other people that I work with at the same level are just like me. So we don't want to take the place of the physicians. They can keep their hours, they can keep their debt, but we're here to help. So I think that's been the hardest thing, is trying to still overcome that barrier and help people understand that we're just here as assistants. We're not here to take anybody's job from them.
So with that in mind, do you have any special words of warning or encouragement as a result of your experience?
I would just say to be aware of that. Know that whatever job you take as a nurse practitioner, you will find one person. There's always that one in every group where you go, or every hospital that you work with. There'll at least be one that you're not going to work 100% with, and that's okay. Not everybody is going to be the best of colleagues with everybody else. And that happens at the physician level too. There are plenty of physicians that don't work well together. But knowing that there is still a little animosity toward nurse practitioners, being able to advocate for yourself you need to be able to advocate for yourself. You need to have the confidence in yourself as a provider to know that you are here for a purpose and be able to stand up for yourself. I have had difficulties with that at times myself, even many years of experience that I have. It's still been difficult at times just because of the connection or lack thereof with the person that I was having an issue with. But knowing that about myself, it's taken some time to work on that as well, so that I've learned to have the confidence that I can actually stand up for what I need. And still, even with that confidence, there's still going to be times when you're going to find struggles with those physicians. But knowing that you need to find somebody else that can help support you. So in my group with the neurologist that I worked with, there were several neurologists that would help me in those times when there was one or two particular people outside of our group that weren't always the best to work with. They would help me work with that person or help me take care of those patients so that I didn't have to feel like I was out there on an island all by myself. So two things, I guess. So knowing that you need to advocate for yourself, and knowing how to have the right resources to help support you when you're needed.
That's excellent. I think it helps to know that even if you have pushback, if you have some relationships that you feel are not as positive, that you can find the resources, you can find some allies, and you can get your job done.
Yeah. I think it was my favorite thing when I heard one of my colleagues just saying that I was a colleague and I wasn't anything less than that. So being put on that same level as the physicians I worked with was huge for my confidence as well. So absolutely there.
I know you only just started in your new job. So it may be a little bit more difficult to answer this, but where do you see yourself in 5 to 10 years?
I'm hoping to see myself still with this same group and just loving it even more than I do. The joy about joining this opportunity is that there's still room for growth. So even though I'm already in a growth opportunity, learning about the spine and not just the brain, so knowing that I can deal with patients that have had surgery, and I can do the post-op teaching and education with them, and I can do all the procedures with the physicians potentially, and taking out drains and taking out sutures and things that I haven't had the opportunity to do. There's still more growth opportunity. I can, if I'd like to, I can start taking call with the group. I can get into the OR and actually work with the surgeons and assist in surgery. So there's still so much room for growth, and I don't think I will run out of opportunities for that. So I'm really excited that about the fact that all the providers that have been there for years. One of the PAs that interviewed me has been there for 17 years. He loves it and doesn't see himself going anywhere else. So the fact that they love their jobs so much helps me to see that I most likely am very much going to love this job as well. The first week in orientation, working with everybody, they're all great teachers. They answer questions. They keep checking in with me to making sure that I feel comfortable and that I know what I need to know. And it's so far been a great environment. And there's always that little honeymoon phase with any job that you start, but knowing that they are still so happy years into their jobs is a very promising thing for me. And having just started my own podcast last year, I hope to continue to do that as well, because I love all the information that I get to share in my podcast too.
I would love if you could tell us a little bit about your podcast before we move on to your long-term plans.
Yeah. So after years of being a nurse practitioner in neurology, I had just gathered a lot of information and wanted to be able to share some of that with others. And finally, after a long time of thinking about it, started up my podcast last fall called Brain Wellness, the podcast. And it is focusing on anything and everything related to brain health and wellness. I have interviewed both people who are living with neurological disorders and those who care for people with neurological disorders. So I've had occupational therapists, physicians, speech therapists, mental health therapists, nutritionists, a little bit of everything on the show. as well as people who have had multiple sclerosis, they've had strokes, they've had migraines, they've had terminal illnesses and neurology that we don't see very often. Really a little bit of everything. And everybody has a story. Even the people who are providing the care, we all have a story of how we got here. And sharing those stories and sharing those life experiences and knowing that we all have similar life experiences, regardless of our backgrounds. It's nice to be able to highlight those on the show as well. And that shared human experience is so exciting to do and to talk about. When after dealing with hospital patients and COVID and mask land, where we don't get to take these masks off forever, it's nice to be able to talk to people face to face, even if it's on a Zoom call, and share those experiences with them. And all the joy that I was losing from healthcare, from all the negative things happening over and over again in the hospital, came right back in the podcast. So I found that joy again, and it's been really kind of addicting to have that there, and really just every episode is so exciting.
It sounds like you're also building your own community.
Yeah,
that's lovely.
Yeah, in a way, yeah.
So I'm sure, along with your work and the podcast, it sounds like you also very much enjoy learning and upskilling and always having something else to learn.
Mm-hmm.
Past the 5 to 10 year mark, what are your long-term goals?
I always want to have to do something with neuroscience. And ever since I got into neurology as a nursing assistant, before I got done with nursing school, I knew that working with the brain is going to be where I was going to be. So regardless of what I do, where I live, it's always going to be brain related. I have a whole little list of things that I want to do related to that. Just keep building on my podcast. I did just put out my first book on migraines. So I do intend to make that a bit of a series, kind of going through the different things one by one. I have all sorts of other ideas for books just to share the knowledge, because I love teaching, and I just want to get that information out to as many people as I can. So I don't see that going away anytime soon. I would love to just keep building on that as well. At the heart of me, I'm a teacher, and regardless of what I do, I love to teach that information. So whatever setting I'm in, I intend to continue to teach the people I work with also, which is also really exciting about this new job, because the practitioners there haven't done as much with the brain side of things as they have with spine. So it's a mutual learning opportunity. I can help them learn the brain care while they help me learn the spine care. And I think that's like a double reward.
Yeah, that sounds pretty perfect.
Mm-hmm.
Very
Mm-hmm.
much harmonious.
Yeah.
And just so that we know, what is the name of your book?
Migraine Help from a Unicorn Nurse Practitioner.
Oh, I love it.
Mm-hmm. So the introduction actually describes what a unicorn nurse practitioner is. A little teaser on it. I've had people tell me that I'm a unicorn because I actually listen and I take people's information into account, and I don't just check off boxes as I go along.
So important. And the fact that people are noticing, it shows how much it means. Now, you mentioned it a little bit, but I'd love to dive a bit deeper into where your interest in neurology comes from.
Yeah. So kind of back a little bit farther. When I was a little girl, I wanted to either be a nurse or a teacher. And I've gotten to be both as I've gone along. And that all stemmed from, we had a very close friend as I was growing up in our church, she was a nurse, and I looked up to her. She was just amazing. I just thought her was a very smart, very kind human being. And her being there was a huge role model for me, even going into nursing to begin with. And so I emulated her. I wanted to be like her when I grew up. And then shortly after I became a nurse, I had the opportunity to float up to the neurology floor, and absolutely loved it. I knew that's where I needed to be right away, because it spoke to me. And in nursing school, I thought I might be an OB nurse. And then I got to the OB rotation and thought, no way, I'm not doing that. And then I thought I might be a cardiology nurse. And the experience that I had on the cardiology floor was less than less than desirable, I will say. And then when I just got to that neurology floor, it just clicked and I absolutely loved it. Fast forward a few years, my mom had a stroke, and her experience of having a stroke, I knew I liked helping people with stroke and neurology, but I didn't know that that was going to be a huge passion of mine until she had her stroke. And I drove a 6 hour drive, and much faster than I should have, to get back home because we had just moved out of state. And I drove as fast as I could to get back home and be at her bedside and help take care of her and be present for the doctors coming in and telling everything about when she had her stroke. And that drove me into stroke care. And from there, I focused almost all my attention on taking care of patients that had strokes. Kind of a subconscious thing, I think, because I wanted to be there to help people that were in my mom's situation.
Hmm.
And that was the focus of my healthcare world up until a week ago.
Wow. It's a
Mhm.
very, very strong feeling, I'm sure, to see a parent go through something and be around patients who are going through something similar and having at least some kind of power over, you're doing something to help the cause.
Mhm. Mhm. And I think of all of the diagnoses in neurology that you can care for, stroke is probably the one that I felt like I had the most impact on, especially when we were taking care of patients who were coming into the emergency room with stroke symptoms. And we had that opportunity to potentially give them a medication that could stop them from having the stroke and potentially reverse their symptoms completely. That was, I think, the biggest rush you could get as a nurse practitioner, because that I felt, at least, because it was so exciting to help somebody that was having such an acute illness, knowing that you could potentially prevent them from having debilitating symptoms and they could get back to their normal life. And it happened so many times, and it was amazing every single time.
And is that something you find to be one of the most rewarding things, is seeing the impact of your work? Maybe not every day, but on a regular basis, that you see your work, the result of
Yeah,
your work and how it impacts other people.
absolutely. Just that ability to have such a huge change in somebody's life. When I first started working as nursing assistant and nurse, if someone came in and they had a stroke, all we could do was offer them therapy and hope for the best and hope that they could regain some function afterwards. And that wasn't always the case. A lot of times they would leave the hospital still just as debilitated. And that patient might come back later on with something else going on, and they weren't much better than the last time we saw them because we didn't have a lot of things we could give them 20 plus years ago. But now there are things that we can do. And I've seen so many patients walk out of the hospital and you'd never know that anything happened to them.
That's incredible.
Yeah.
It's amazing the kind of changes in the medical field just over several years.
Hmm. Hmm.
Wow. Is that the one that you feel has been the most important change that you've seen? Or are there other things that you've seen innovate or get put in place that you think are really groundbreaking?
Oh gosh, there have been so many things. It's nursing now is not what it was 20 some years ago when I started. There are so many more things that we can do for every patient that comes in the door. There sometimes I think there are still some archaic things that we do, especially in mental health. They still do like electric shock treatment that we probably heard of decades ago. There's still a role for that. So I sometimes think that we haven't gone very far in healthcare, but other times just seeing what we can do. Patients are living longer because of what we do. And we are keeping people going possibly much longer than their initial expiration date would have been, because of all the technologies that we have. Surgeries are so much more efficient now than they used to be. The technology that we use in surgeries, we can do surgeries that we didn't used to be able to. Um, I, on my show, recently got to interview a gal who had a brain aneurysm rupture. 20 years ago, she would have died in a hospital. And instead, now I'm interviewing her and she is running her life almost as normal, just taking more naps than she used to. And
Wow.
the fact that we can bring people back from the brink of death is amazing.
That's
It's just
incredible.
amazing. Yeah.
Yeah. I think purely from TV and movies, the general population probably thinks that if you have a brain aneurysm, you die. There is no
Yeah.
getting out of it, but that's very amazing to hear. That's
Yeah.
incredible.
Yeah. So just things that we can do for people now that we couldn't even 20 years ago is just amazing. We're constantly learning new technologies, and that's one thing that's required of us, but one thing that's it's not only required, but just have to do it to be able to keep up with everything. But it is required that we do continuous education and learn about new things because there are so many new things happening all the time. It's
Hmm.
I've heard jokes about different places and their weather before, and if you don't like the weather, wait an hour and it'll change. Well, if you don't like the outcome with your health thing, just wait a couple months and there'll be a new option for you. So there's always something new coming out to help people.
That's so exciting. It's
Mhm.
it's the the continuous learning process that there's always going to be something else. There's no boredom.
Right, right. If you're bored, it's your own fault.
You gotta take that on for yourself.
Yes.
And there's so many parts of your job that you love. I'm very curious if you ever decided to leave, what is it that would kind of push you out that door to say, I don't think that this is for me anymore,
Mm,
or at least for now.
yeah, I think if my independence was ever taken away from me, I think I would have a really, really big, difficult time with it. Part of the reason I wanted to be a nurse practitioner was because I wanted to have more responsibility with my patients and I wanted to be able to have more of an impact. And that threat came pretty close at my last job because things were starting to go backwards in our independence. And I was not happy with giving up the abilities that I'd had for the last 10 years. So
Hmm.
I think if that was ever completely taken away, I think I would probably have to take a step back because I do love what I do with my patients. And I love the fact that I can make an impact on them and we can sit down and I can educate them about their health process. But if I'm not given the opportunity to work with those patients, I can't do that education and I can't have that impact that I so greatly desire.
Hmm. So given the different changes that you've seen there and the different places you can work in hospitals, in clinics, and the different kinds of management that could be put in place, is there a typical culture for your profession, do you find, or is it really just dependent on where you end up?
It really depends on where you end up. Your management can make or break your job.
Mm.
The administration at the facility can make or break your job because they make decisions that don't necessarily come from a place of practice. When you think about it, the people that are in the administration and healthcare facilities, they have masters in business administration. They have masters in just business in general. It's not a healthcare degree that they have. They're not the ones generally that are at the bedside providing the care. So they make decisions that they think they're making out of the best interest of everybody, but they don't ultimately 100% know the impact of those decisions because they're not at the bedside seeing the outcomes of it. So they absolutely can make or break your experience. I've gone to different places where we say that things are kind of a different way because you are in this particular location. So for example, I worked at one place called Mercy, and it was the Mercy way of doing things. And I worked at one place called Gunderson. It was the Gunderson way. So everybody has their own way of things. There's always going to be little idiosyncrasies based on where you work. And again, it kind of leads back to what we were talking about before, finding out if that organization fits your needs
Hmm.
and if it fits your personal values.
So not to get discouraged. If you're not enjoying the culture in one place, you can go somewhere else. You can find a
Absolutely.
place that fits you. That's amazing.
Absolutely.
Along those lines,
Mhm.
what are some current issues and trends that are developing in the field that those who are interested in pursuing the same kind of career as you've had, that they should be aware of? And, is the field changing in specific ways that anyone who's interested or starting off should have their eye on?
Nursing specifically, there have been some changes in recent years. I started as an associate degree nurse, and I started in the hospital as an associate degree nurse. Not everybody is hiring associate degree nurses anymore in the hospital. I think the opportunity for where you start might differ, because as an associate degree nurse, some places will have limitations where you can only do long-term care or nursing home type of setting rather than working in a hospital directly. So that's one change, kind of at a lower level than where I'm at right now, but it will impact your experience as you go along. So if you ultimately want to be a nurse practitioner in the end, it might be a different route to get there, because you might not be able to go directly into the hospital. As far as changes that affect nurse practitioners, some of it still is a little bit of pushback from the physicians, because that hasn't gone away yet. It's not 100% accepted for nurse practitioners by all the physicians that are in the field. There are a lot that absolutely love it. I've worked with some physicians that absolutely love having us there, because we can give a little bit more time to the patients, and we can answer those questions that they might not have the opportunity to answer. But it still may be a barrier to getting in. And I think some of the other barriers that just haven't gone away yet is the fact that while nurse practitioners are nationally recognized, at least in the United States, it's a national recognition, national certification exam that I had to take to be a nurse practitioner. The states have their different rights on what a nurse practitioner can do. So whereas in Minnesota, I'm licensed as an independent practitioner, I can go out and do pretty much anything that I want to do. There might be a little bit limitations based on where I work. So different facilities that I've worked at, still, I had to have a physician sign off on at least a certain percentage of my notes because of their facility policy. But if I were to go to a different state, it might be quite different what I can and can't do as a nurse practitioner, because the states still have those differences. So that's a bit of a limitation as well. If you're somebody who wants to be able to get up and move and go someplace else, you need to look into those potential limitations to what your practice might look like if you went to a different state.
Yeah, that's really good advice. And it's something that people may not think of, that you can just blanket, do the same kind of work, respond, and have the same responsibilities anywhere you go. That it really depends. So that's very important for people to keep in mind. And what kind of accomplishments tend to be valued and rewarded in the field, at least in your experience?
Yeah, there can be so many. Oh my gosh. As a nurse and nurse practitioner, I've had the opportunity to be on different research groups, where in the different facilities that I've worked, we have worked on either actual research on patients. Where I worked at the university hospital, we did research all the time, and I would help give research medication. So I could be a part of that research project. And depending on your level of involvement of that, your name might get put on that research project. And there were a couple of times when I was involved in process improvement projects that were big enough, they made a big enough impact that we actually submitted them to national conferences to be presented at those national conferences. So my name was on, there was one year that I broke my leg and I had a baby and I wasn't able to go to the conference, but my name was on a poster that went to Hawaii because we did a process improvement project that was important enough that it was accepted for a poster presentation at that national conference. So that definitely gets recognized. Within the facility, you will get like plastered all over the intranet at that facility so that everybody can see your accomplishment there. So being involved in research, doing some kind of process improvement, things that whatever you can be involved in, there is definitely room for accomplishment. If you want to take on leadership positions, you can be a leader in the environment that you work in. You don't have to have a leadership position to be a leader. And that's one thing that people need to think about as well. You don't have to be management on the unit to be a leader. If you are a ray of shining light in your unit, you can be a leader by setting that example for others for what kind of environment it's going to be. And the last neurology floor that I worked on had some really great leaders that the younger staff looked up to them, and they would help make changes because they would share information with the rest of the people. So acknowledgement can happen at various levels, and it doesn't have to be a national recognition to get that. It can be local. It can be just a shout out on your unit if you did something great, which as I was in orientation this past week, several of the units at one of the hospitals I was shadowing at have these shout out boards, and you can literally shout out one of your colleagues for doing something amazing. And those amazing things can come in the form of holding a patient's hand when they didn't have anybody there with them. It can be in the form of just helping out when call lights were going crazy and everybody was busy, but you took the time to go help them. So it's all in the level of accomplishment that you feel you want to get. You can get it any way you want to.
That's so nice. It shows that an accomplishment is also what you make it. Maybe you don't have the ambition to go to, I don't know how many conferences a year and have your name on posters, but getting a shout out from a colleague can really help make your day as well. And just that can give you the energy to keep going.
Yeah. I still have a file folder in my office as well of a few thank yous that I've gotten from patients. So those have meant the world to me. And when I look at them, I can still see the patient that gave it to me because it meant so much.
Oh, that's amazing. It does. I imagine it does stick with you when you get those. And I'm sure it's vice versa. I'm sure you've stuck with them.
Yeah, there have been some people that I haven't seen them in forever, and I can run into them at the store where I did not think I would run into them, and I had a couple people run up to me one time and they thanked me again for taking care of them. And I had to stop and think where it was that I saw them, because I've seen so many people over the years, but they gave me a little bit more information. I'm like, oh my gosh, I didn't think I'd ever see you again, but you look fantastic.
Oh, I love it.
So yeah, it's fun. It's a lot of fun.
Great. So we talked about accomplishments, but what other kinds of experience, either paid or unpaid, would you encourage anyone who's interested in pursuing this kind of career that they should look into, and how can those be obtained, at least typically?
Yeah. So when you think that you want to be in a healthcare position, I always encourage people to shadow. And prior to COVID, it was a whole lot easier to do this because you could just talk to anybody that you knew. And there's generally a privacy form that you have to sign to agree that, yes, whatever you see on this day, you're not going to go and tell your family or your neighbors about somebody that you saw in the clinic or whatever situation you're shadowing in. There will be some kind of privacy document that you'll have to sign to say, yes, I'll keep this all private. And it still is possible, but it's a little bit more difficult these days to get into those experiences. But that would be my number one. So if you know what kind of position you want to get into, see if you can shadow that person. It might be completely different than what you anticipate it's going to be. Good example of this, my son, I have a 25-year-old son who thought that he wanted to be in sports medicine, possibly an orthopedic surgeon. One of the hospitals I worked at had a couple of great orthopedic surgeons. I talked to them all the time, and I said, hey, my kid wants to shadow. Do you mind having him come shadow with you? And he said, absolutely not. Sent me the document that he needed to sign for the clinic, and it set up a couple of days for him to go shadow. He shadowed in the OR and he absolutely loved it. He shadowed in the clinic and he said, Mom, I don't want to do clinic. And I said, buddy, if you're going to do surgery, you got to be able to do clinic afterwards. So it was a really good opportunity for him to learn what he didn't want to do. So sometimes you have an idea in mind, you see it on a movie or on a TV show, and you think, man, that's going to be a really great opportunity. I so want to do that. Shadow in that experience and see what it actually looks like on a day-to-day basis. I recommend doing it in more than one setting if you can, so you can see how different settings work. Maybe you look in a clinic, maybe you look in a hospital, different types of things, so you can see, is this actually an environment that you want to be in? When I started as a nurse, you had to be a nursing assistant first before you could go into nursing school. Some of the schools still require the certification, but they don't require the experience. And I think that experience is so valuable. So if you think you want to work somewhere in healthcare, I do recommend starting as a nursing assistant, regardless of which role you want to be, because you will get to see everybody else that's there. As a nursing assistant, I saw the physicians, I saw the PAs, I saw the nurses, I saw housekeeping, nutrition, everything. I saw the therapists. I got to see what everybody did, and I was there to help turn a patient or help feed a patient while they were doing all their tasks. So I could see if that was something I wanted to do or not. I fell in love with it. Not everybody does, but that's what definitely solidified in me that yes, I want to be in healthcare because I got to have that experience. I didn't shadow first. I did the paid opportunity, but you can do the paid opportunity. There is that. And you get some money as well as while you're learning.
Also very important sometimes.
Yeah. Yes.
What do you wish you'd known when you were first starting out in your career?
I think, I don't know that there's really much that I wish that I would have known because I did start as a nursing assistant and I knew other people that had been in healthcare. So I really knew a lot as I was going on. So I don't know that there's anything that I didn't know per se, except the fact that I wish I would have known that 20 years into it, there were still going to be people that kind of didn't understand the different roles in healthcare. So I think if anything, that would be it. And just knowing that I was always going to have to explain myself in healthcare to some degree. Some days I feel like a broken record because I'm explaining myself all the time, but it depends on the setting. Like I said, once I explain myself to my patients, they understand it. They're cool with it. They absolutely love it. And then I have some that even after I explain what I do, they still call me doctor because they say, well, I don't care what you do. You're still my doctor. Like, okay, I've done my explanation. I'm not going to try to dig on that one anymore. But I didn't know that I was going to have to explain myself all the time. I think that's the one thing that I wish I would have known. I don't think it would have done anything different, even based on that, because at the end of the day, I love what I do. And even if I have to explain to a few people why I'm doing what I'm doing, it's an opportunity to help remind myself why I do what I do.
I absolutely love that. As with many things you've said during this interview, and I want to thank you so much for joining me today. I think everything that you've said, the advice you've given is really important for people to hear. I think it's really important for people to learn more about it too and see what their interest levels could be, or if they're starting out, what they can expect, and how you've gone through it and how you came out of it in the end.
Mm-hmm.
But before we leave, I would love to give you the floor to speak to those who are either studying to go into a similar career field, or starting out, or even just thinking about it. What would you like to say to those people?
I think the biggest thing I'd like to say is if you think you want to do it, do it. Don't let anything stop you. I had a 2-year-old son when I started in nursing school, and for all practical purposes, I shouldn't have kept going with college because at that point I had a lot of people questioning me, why are you doing this? Why don't you just go get a job? And I could have gone and got some other little job, but it wouldn't have had the same impact on my patients today had I made a different choice 20 years ago. So the fact that I wanted to do it, I'm glad that I kept pushing. I'm glad that I kept pushing myself because I'm doing exactly what I wanted to do, exactly when I wanted to do it. It might have taken me a few more steps along the way, and I took a non-traditional route, but that's okay too. Just the big thing, no matter what stage you are in it, whether you're contemplating it, whether you're early on in it, whether you're in school and things seem to be really daunting, just keep going, keep pushing. There's that old adage that if you want something bad enough, you can get it. While there are sometimes limitations to that, the more you want something, the harder you're going to work for it. And the big thing, if you're struggling, is think about your why. Think about why you're doing this to begin with. I started all this because I wanted to make a better life for myself and my child. And I've had 2 other kids since that time. And my kids love that I'm a nurse practitioner. They love that I have a podcast now. They love all the things that I do. And they're proud to call me mom. My kids have told me they're proud of me. And that, at the end of the day, is bigger than anything that I could do because I know that I'm doing exactly what I should be doing. So again, regardless of where you are, keep pushing, keep going for it. Because if this is what you want to do, if you're being called to do this, you need to make it work. And it will work as it's supposed to.
Definitely words of wisdom. Thank you so much for joining me today, Mandi. This was a fantastic interview, great pieces of advice. And for everyone listening, watching, You'll be able to find Mandi's podcast as well as the name of her book in the notes or in the caption.
Thank you.